Well, you're the director of one of the biggest health departments in the nation, so perhaps you can give us the numbers. I see different statistics in the national media, but the regular flu kills around 36,000 people a year, if I'm correct. Correct me if I'm wrong.
That's correct. That's
And this flu has killed how many?
Well, locally, we've had 11 deaths in Dallas County. And then in terms of just Texas and throughout the nation, you saw a significant amount of deaths. So the concern is that here in Dallas County, we've had 11 deaths, predominantly among teenage kids, children, and that's a concern. So our concern nationally is that it has been a staggering number of deaths, and the concern is how much, deaths are we going to see associated with H1N1. We have to begin to get the vaccine out there to vaccinate our community to prevent future deaths. We don't know what the number may be in terms of H1N1. We clearly know about seasonal flu because we've been dealing with this for years, but this is a new virus, and what impact it's going to have, we don't know, but we do know you got to get the vaccine out there.
Sure, Mr. Thompson, my concern is the number we've got is around 5,000 deaths, and I understand that the season's just now getting into full swing, but many experts and many headlines I read state that it looks like this flu isn't as deadly as the regular swine. That the swine flu isn't as deadly as the regular seasonal flu. So what is all the fear about? What is the big concern? What are the feds and other experts telling you the reason for so much concern is?
Well, you're right. That's a national number. I think no one is telling us. We're just basing it on the fact of the deaths we've seen here locally, and we realize the impact H1N1 is having on our community in Dallas County. This is not about a fear factor. Let me be real clear. This is about the fact that you have to put yourself in the place of a mother whose child has died from H1N1 or a child whose parent has died from H1N1, and you got to personalize it from the standpoint that this has been a deadly virus. We don't know what the number may get up to. We're seeing fluctuations throughout the United States. Basically, you see high number of cases in some parts of the United States, low numbers in other parts of the United States. Clearly, no one knows what to expect, but the preparation, we've asked for two things. One, prevention tips. Cover your mouth when you cough or sneeze. Stay at home when you're sick. But the key ingredient is in the vaccine. We don't know what the death toll may be if we continue without the vaccine. That's the real key right there. So I won't get into the debate whether or not this is any more different than seasonal flu. I'm just saying you had people who have died from H1N1 related.
No, I understand. Yeah. Mr. Thompson, the director of the Dallas County Department of Health and Human Services, Office of Public Information, the issue here is we see these reports out of New York and out of Boston where they attempted to make medical workers and nurses take the shots. They've now lost in court. Dallas County isn't attempting to make medical workers take it, are they? Or what's the policy there?
No, and I think the question really on the table is whether or not, in terms of offering it to your public health workers, first responders, that opportunity to take the vaccine. So I don't know how, what's going on in those other states. We're saying that we make it available to first responders, to our public health care workers, and give them that option since they're going to be the ones on the front line when we open up these.
So they're not being pressured. They're not being pressured in Dallas County to take it then.
No, I'm not aware of anybody being pressured in Dallas County, and we're not. We make it available for public health workers and first responders, basically because they will be on the front lines of responding to the setup and administering, doing a vaccination.
Sir. When did Dallas County start giving the nasal vaccine?
About 2 weeks ago. We received 700 doses of the nasal spray vaccine about 2 weeks ago.
Have you read the mainstream media reports that it's actually a live attenuated virus and that it can actually mutate or spread the H1N1 itself?
Right. Everyone is aware of that, yes. I think the key is, if you read the CDC guidelines, is that only healthy people can take the nasal spray. So if you really got to make sure that the nasal spray was made available to healthy individuals in Dallas County. And then the injectable, which came in almost a week or week and a half later, that's made available to the general public.
Sir, what are the public schools doing? Because we see different headlines in the state of Texas and outside the state where their county health departments and city health departments are adding it to the list of mandatory vaccines for school children, the regular, seasonal, and the H1N1. And then I have parents, and that's why we appreciate you coming on, because you are an authority on this, an expert, because you're there over a large county and actually know what the facts are. What is the real policy in the public schools?
Well, I'm not aware of a policy in the Texas school district that requires anyone to take the flu shot or the H1N1 vaccine. The recommendations are on vaccinations, the normal vaccines that are required for school, which are the basic varicella, tetanus, MMR. I've not read anywhere what anyone has been mandated in the Texas school district, but I can't speak for all Texas schools in Dallas County. That's not been a requirement, so I don't know where that information may have come from. There is quite a confusion because of the back-to-school immunizations, and a lot of parents didn't get their kids in before the September 1 deadline. That the state issued a 1-month extension until October 1st for individuals to get their families in, get their children in, to get their immunizations updated.
And is the regular seasonal flu on that list?
No, it's not on. It's not on.
Is Gardasil still on the list?
Well, no, I'm not aware of Gardasil being on that list. No.
Well, you remember Rick Perry last year saying girls had to take it, and he was instructing the health departments to implement that?
Yeah, but it's not on a requirement for back to school, no.
Okay. Again, we're talking to the Department of Health and Human Services, Office of Public Information, Dallas County Director Zachary Thompson. Sir, I saw a story out in the Statesman a few weeks ago, and I've seen them in Oregon. I've seen them in New York State as well. Perhaps you can enlighten us on this subject, and that deals with fact sheets being given out to the parents of children, to the children in the independent school districts around the country, explaining the basics about the vaccine and clearing up some of the misunderstandings. Is Dallas County issuing any type of fact sheets like that?
Well, I think anyone that takes the vaccine or come in to get their children administered the vaccine has to review that information and make a decision whether or not they want their children to receive the vaccine. And
are they signing forms? Are people signing waiver forms when they take the H1N1?
Well, I think you sign a form after acknowledging that you've been given education about it and that you're willing to have your child immunized. It's your choice whether or not you want your kids to be vaccinated.
I understand.
Right.
Well, I want to give you the last word in a moment, but I did want to bring this up to you because I'm sure you're a very nice, intelligent, informed person who genuinely cares about the community. Our issue is we've seen copies of what's being given out in Travis County here in Austin. We've seen copies of it in Oregon. And the New York Times has a public school program in New York State, but also in other states, that states there is no mercury in the shots, that states there is no connection to Guillain-Barré syndrome or other neurological disorders within 6 weeks of receiving it. But I happen to have the actual inserts, not the fact sheets, but the inserts, and the FDA.gov Norvitis Vaccine Diagnostics Limited report that actually comes to the medical workers and doctors with it. And it states that this is an experimental vaccine that has a lot of side effects. A, were you aware of that? And B, is the information you're giving to parents of school children when they come in to get the shots, does the information in Dallas County have that information in it?
I believe it does. We just got the vaccine in. We have not administered it to any kids, but I'll take a look at it and be more informed about whether or not that is the case. I think I want to clear up one thing, is that the option is there. Whether or not a parent wants their kid to take the vaccine, clearly there is due diligence in terms of that. So it's not mandatory. It is optional. So the issues that you bring up are one that all parents should consider regarding whether or not they want their child to take the vaccine.
Do you have children, Mr. Thompson?
Yes, I do.
Are you vaccinating your children?
Well, my child happens to be 25, so he can make that decision himself.
But, okay, have you taken the flu shot?
The seasonal flu, yes.